How can one tell or suspect that you lack vitamin B12? You may develop pins and needle sensations in your hands and lower extremities, and you may have unsteady walking disability. Shortage of B12 can damage the protective sheath that covers your nerves and cause these neurological issues. Diseases like Crohn's or other gut illnesses may make it harder for your body to absorb vitamin B12. Taking heartburn tablets too will affect this vitamin absorption. Those diabetics on metformin tablets reduce vitamin B12 concentration and cause a deficiency. Vegans having diabetes and on metformin need to worry about their vitamin B12 levels and need to take supplements with fortified cereals and other foods. If you feel unusually colder, this could be an early sign that you have vitamin B12 deficiency. Without enough B12, you might not have enough healthy red blood cells to move oxygen around through the blood vessels and keep your body warm. Headaches, pale skin, or being breathless and fatigued for no reason, then think that you may be suffering from vitamin B12 deficiency. Fatigue may be common in other illnesses or just due to lack of exercise, but fatigue or tiredness with vitamin B12 deficiency is accompanied with other symptoms mentioned. With further time with no diagnosis made, you may get confused, have cognitive impairment, paranoia, delusions, mania, psychosis, memory loss, incontinence when passing urine, and loss of taste and smell. Lack of B12 may lead to these symptoms of depression due to brain fog. You are recommended by your doctor 2.4 micrograms of B12 a day. If you take too much, the rest passes in your urine. Higher doses of B12 can have side effects like dizziness, headache, nausea, and vomiting. So always stick to the recommended dose by your doctor. If you feel that your muscles feel weak and lack strength, you need to suspect it could be due to B12 deficiency. If you feel that your tongue is smooth and glossy when you brush your teeth in the morning, that could be an early sign of B12 deficiency. Certain medications too can give a smooth, glossy tongue. You may get mouth ulcers on your gums or tongue. You may not be able to enjoy your spiced meals. Be aware this could be due to vitamin B12 deficiency. Some drugs can drop your vitamin B12 level in your blood, such as chloramphenicol, proton pump inhibitors given for heartburn, cimetidine given for stomach ulcers, and metformin as mentioned earlier. In vitamin B12 deficiency, your heart rate may become rapid or feel having skip beats. Vitamin B12, also known as cobalamin, is a water-soluble vitamin involved in metabolism. It is required by animals which use it as a cofactor in DNA synthesis in both fatty acids and amino acid metabolism. Vitamin B12 or cobalamin plays an essential role in red blood cell formation, cell metabolism, nerve functions, and the production of DNA, the molecules inside cells that carry genetic information. Food sources of vitamin B12 include poultry, meat, fish, oysters, mackerels, salmon, and dairy products. Beef liver is one of the best sources of vitamin B12. Chicken, eggs, and fish are the next best sources. It is also added to some foods such as fortified breakfast cereals and is available as an oral supplement. Further, deficiency in vitamin B12 can cause megaloblastic macrocytic anemia. In this situation, the red blood cells are larger than usual and irregular in shape. This deficiency can cause damage to the white matter of the spinal cord and brain and peripheral neuropathy, resulting in symptoms already mentioned. This deficiency can be seen among vegans due to inadequate intake of vitamin B12. Foods-bound vitamin B12 is released in the stomach's acid environment, binds with the intrinsic factor secreted in the stomach lining cells and get absorbed in the terminal small gut. Inadequate vitamin B12 absorption is most seen in the elderly due to inadequate absorption as a result from decreased acid secretion in the stomach, which produces the intrinsic factor. Older people are advised to take vitamin B12 supplements to avoid anemia, nerve damage, moodiness, and other serious problems. Inadequate absorption may occur in a combination illness called blind loop syndrome with overgrowth of bacteria or tapeworm infestation. They ingest the vitamin B12, so less is available for absorption. Vitamin B12 absorption may be inadequate in inflammatory diseases of the bowel or when the gut is surgically removed. Inflammatory bowel diseases include Crohn's disease and ulcerative colitis. Pernicious anemia is a type of anemia resulting from vitamin B12 deficiency. Here too, there is atrophy of the gastric inner lining with loss of intrinsic factor. Patients with classic pernicious anemia, most common among young adults, are at increased risk of stomach and other gastrointestinal cancers. If you lose your appetite and as a result lose weight and have constipation, may be due to vitamin B12 deficiency. It takes time for vitamin B12 deficiency to show early symptoms, as they are slow to appear at the onset. In some of the symptoms may come on relatively quickly, so the doctors find it difficult to suspect during the early stages other than from a blood test. It is sensible for elderly people to request for a specific blood test on their annual routine medical checkups. Today, most breads, grains, pasta, eggs, noodles, rice, cereals, orange drinks and tomato juices are fortified with B12. Standard multivitamin tablets too have B12 incorporated. Lentils, being a cheap popular legume cooked as a curry to eat with rice and bread in Sri Lanka, don't seem to have B12. So people who eat red meat, seafood and dairy products do get sufficient B12, but for older people it is advisable to take a supplement. Annual blood levels for B12 needs to be checked up on your routine blood tests as advised. Hope this video talk was useful. Stay safe and goodbye for now.